everyone. I hope you're joining us today in Apollo 24/7's Health Hour, where we're going to talk about cancer, the root causes, risk factors, and prevention. Let's understand more about it. And you're welcome to ask all the questions and queries that you want to ask about cancer. Joining us shortly at 11 a.m. is Apollo's expert oncologist, Dr. Venkat P. from Apollo Cancer Center, Chennai. So get ready with your questions. See you there at 11 a.m. sharp.
It's always been there, standing between you and your health. A wall. Between a pain that won't disappear and a doctor who magically appears. Between a long wait on a hospital bench and staying right where you are, at home. Between finding yourself out of medicines and finding them at your doorstep, whatever the time. Between years of health records all over the place and all your records in one organized access from anywhere place. Between your current regimen and the recommended routine. The wall. We don't need it anymore. Say hello to Apollo 24/7. This is India's largest end-to-end omni-channel healthcare ecosystem, designed to touch more lives than ever before and delivering its promise in 3 important ways. 1. Listen. Talk to us anytime from anywhere. We've got 7,000 doctors and 30,000 healthcare professionals listening. 2. Advise. We'll give you expert advice you can rely on, because it comes from India's #1 healthcare provider. 3. Assist. We bring you India's largest health network of pharmacies, clinics, hospitals and health insurance experts. 20 million people already trust us for their care, and a further 50,000 people are discovering this every day. Apollo 24/7. Expertise is for everyone.
Namaskar and welcome to Apollo 24/7's Health Hour, a show which has been the lighthouse, which has been guiding millions of people, connecting experts from Apollo hospitals to common questions. Where you have a doubt, we are here with information. We've been doing this week after week, bringing you Apollo experts, and this show brings you an opportunity of asking your question in the live chat box. So please go ahead, mention all the details that you want to ask about today's topic, which is cancer prevention and healthy living. Joining us shortly is Dr. Venkat P, Senior Consultant Surgical Oncology from Apollo Cancer Center, Chennai. I request all the audience who are here on the live session, if you have any query, make sure that you type your question with all the probable details that you have on hand, and make sure that all the details are in one message so that it will be easy for me to read the question out. This is a request from my end. Do not make parts of your question because it's getting difficult for me to scroll down through. So please mention your age, gender, and the question that you're asking in one single question. Thank you. Please go ahead and ask all the questions. And your question is not just your question, it's an answer for many more people. Let's start the show today by talking about a wonderful initiative which is called Saving a Child's Health Initiative, which in short we are calling SACHI, which is free pediatric consultations for every child in need. This is a mission to make quality healthcare accessible to underprivileged children at no cost. In association with Apollo 24/7 and Apollo Foundation, we are bringing more than 10 plus pediatric specialities, which is benefiting children across India. All the renowned Apollo pediatricians are available to give healthcare, which is making healthcare accessible to underprivileged children. If you know somebody who requires this kind of consultation, do scan the QR code which is on the screen, or there's a link below in the chat box. Go ahead and spread a good word about Sachi. Well, let's start today's topic, cancer prevention and healthy living, which all of us, this is a dreaded word and a dreaded disease. We're all looking out for information. Joining us shortly on the show is Dr. Venkat P, Senior Consultant Surgical Oncology from Apollo Cancer Center, Chennai. And he's going to give us some wonderful, amazing inputs on managing cancer. Dr. Venkat is a senior consultant surgical oncologist who has more than 20 years of experience treating and healing patients with severe cases of cancer. Special areas of his interests are breast oncology, gastrointestinal cancer, gynecological cancer, and he's awarded the Lifetime Achievement Award from Rotary Club of International for outstanding service in the field of cancer. He's the esteemed member of various medical societies like Indian Society of Oncology, Indian Association of Surgical Oncology, and Association of Surgeons of India. It's a pleasure and honor to have Dr. Venkat P on the show. Namaste, sir. Welcome to the show.
Namaste, Jansi.
Great, sir. So we have just observed World Cancer Day on 4th of February. And understanding that it's very important to spread awareness here, it's good to have you on a Sunday morning with us, Doctor. So, thank you. Why is Cancer Awareness Day so important, and what is the theme that we are operating right now?
See, every thing has a day. Cancer Awareness Day is very important because it gives out a lot of information to people. And again, we have got a theme. The theme for this year is close the care gap. That's the theme for this year. The idea of this is in all big metros, we have got a good treatment, affordable treatment, everything is there. But you need to know that most of our population, rural areas, do not have the treatment for cancer. So the entire idea of this theme is to close the care gap, to get the whatever treatment which is available for the patients in the metros, to get it to the rural areas. That's the idea of the entire theme.
Yes, so understanding that awareness and access to the care is very important. We should bridge, and that's where Apollo is doing its great service to remote service to patients in rural area. Appreciating your service once again, Doctor. So let me start with one common question. Understanding that India is heading towards increase in number of cancer cases, what are the kinds of cancers that we're finding in the country?
See, usually we divide the cancers into cancers occurring in the male and cancer occurring in the female. The most common cancers occurring in the male are lung cancer, stomach cancer, and esophageal cancers. And somewhere in North India, it's more of oral cancers also. Some cancers, most of the cancer occurring in the women are predominantly, it's going to be a breast cancer, ovarian cancer, and cervical cancers.
Okay.
These are the three cancers, both the sexes.
Right. So cancers can be of any type. It can affect anybody. The common thing that we are seeing, there's a shift in cancers. Earlier, we used to think that cancer is only for elderly people or certain age you cross, then cancer can come. But now we're seeing increase of this cancer incident in younger people as well. Why is it so, and who should be worried?
So I think all of us should be worried because it's the entire thing is cancer has become more of a lifestyle disease. Say everything including surrounding us, the stress, the food we eat, the air which is polluted, and then the lack of exercise due to the sedentary lifestyle and sedentary works, everything, and the eating out, again, number of people who are drinking, number of people who are smoking have gone up considerably. So everything is attributing to the cancer. Earlier days, if you see, all these things were totally less. We used to sleep early, we used to eat only home food, and now entire thing is changing. This has become predominantly a lifestyle disease, and every factor in a way just contributes to the increasing incidence of cancer. So basically, we need to be worried about it, and this is something which is not under our control. Within this gamut, whichever is under our control, we need to try and change it.
All right. So, how do we understand that this is a sign of cancer? What are the warning signals that it gives before, and how long does it give it a sign before?
So usually the cancer can occur from head to foot anywhere. There are multiple cancers. Each and every cancer can have a different symptom. I'll just go on a broad base. Say sudden a swelling, suddenly increasing in size, ulcer in the tongue or in the anywhere in the skin or something, which is not healing for a long time. Sometimes bleeding from the motion passage, bleeding from the vagina, and unexplained bleeding, and sometimes foul smelling discharges, and sudden loss of appetite, loss of weight. So all these are kind of little warning signs. Again, whenever these signs occur, we need not worry. Say suddenly what happens, people get a small swelling, they start go to the other extreme. Everything they start worrying it's a cancer. It's not the case. Usually we need to be, it's a long standing, maybe a month, 2 months, 3 months, which is slowly increasing in size. Only then we need to worry. Otherwise, not any, every swelling is not, every ulcer is not a cause of concern.
Right. So, warning signs cannot be taken lightly. You need to monitor them and you need to consult at the right time. Talking about this, I've been hearing about this mantra, which is early detection. How good does this hold even now, and why is early detection so important if it is so?
See, the early detection of cancer is very, very, very important because there are some cancers that a normal cell does not change into a cancer cell overnight. There are multiple stages before a normal cell goes into a cancer cell. So the most important thing is we need to pick it up in between this area. We need to pick up the patient. So that is why early detection is very, very important. That is where the screening comes into play. And again, any after that, once the symptom arises, even then trying to get an early access to the treatment plays an important role. So these two put together will definitely help the treatment to be completed early. Again, the chance of undergoing a major treatment is less. Again, the percentage of cure is more. So early detection is the mantra. We need to just be aware. We need to be open to our eyes and brains so that we just pick up something early.
Correct. So, early detection screenings that we all do, is it only for certain kinds of cancers, or does this kind of screening have screening for all types of cancers?
See, okay, screening by the term, we do the screening for the top cancer prevalent in that particular country, that particular area. So
Right.
uh, the screening, say that's why I said the cancer can occur from head to foot. So we cannot keep say the cancer can occur from head to foot. We cannot keep doing screening for all the organs in the body. So that
Yes.
particular area which is prevalent, we need to see. So based on that particular organ, then we need to do a screening. Predominantly, the common cancers what we do a screening are breast cancer, cervical cancer, stomach cancer, esophageal cancer. These are the common cancers which we do a screening.
Right. So, who needs to be more careful? If somebody has people who have cancer in the family, history may run hota hai. So, when do they start to be careful? Do they need to be careful?
Say, yeah. So generally, there's a any genetics plays a role in cancer in about 5 to 10% of the patients. That is very very that's the percentage. Again, not all cancers are genetic. Again, cancer occurs in few cancers like breast cancer, again ovarian cancer, colonic cancer, endometrial cancer. These are the cancers which are more genetic prevalent. So whenever the patient occurs, when the patient generally it's a family, two or three first degree relatives or the family members has got a breast cancer or an ovarian cancer, then we need to do a screening for the younger generation. The screening, the
Okay.
first is what we need to do is a genetic testing. A genetic testing will let us know what is the percentage of these patients' chance of developing cancer. In
Yeah.
case the percentage of patients developing cancer is more, then we need to keep the patients on close surveillance by doing regular checkups and regular investigations based on the type of cancers which we expect that for particular patients to develop. Say if it's going to be a breast cancer, then we expect the patients to keep doing a regular MRI mammogram at a younger age group. Again, if it's going to be a case of colonic cancer, then we expect once in 2 years to be a colonoscopy to be done.
Okay. So this needs to be monitored, and then somebody has these kind of cancers. It's important to pass down the generations with this information, which is also
Exactly.
important. Nothing to
Ex-
hide information about. If you hide, you are actually doing the damage.
Injustice. So nowadays we get patients where younger generation we identify, say the other end of the spectrum I'm talking about. Young girl who's around 35 has been diagnosed having breast cancer, who has got one female child. Okay, again this particular patient we do a BRCA1, BRCA2 testing. It comes positive. Next,
Okay.
what happens? They start worrying about the child. See, that's another thing. Say, I always advise them there is nothing to panic. So that let us not worry anything about the child at this point of time. Even the child, you can't keep doing multiple tests and keep giving a negative information to a child. So let us wait
Right.
until the child is around 30 years of age. Then we can do a testing and then take it forward.
So just because there is testing, no hurry of getting it earlier done and then panic. Panic
The
doesn't
most
hold
important
good and in cancer.
it it definitely does a lot of negative issues for the patient and the family. Again, is before getting these genetic tests, what is happening in India is we have got all access to all the tests and things like that. The patients go directly get the testing and done. See, this
Okay.
should all this is also the wrong thing. We should not do it. Whenever we are doing a genetic testing, you need to meet the doctor. You need to undergo the counseling completely, and then you should be a candidate for the genetic test. Only then we should do it. We should not do it just for the sake of doing. It creates a lot of anxiety. Genetic test, a
Done.
very simple, is just a blood test.
Okay. So, Dr. Venkat, one important question is that people are afraid of cancers and the treatment of cancer. How far has our medical technology come, and what kind of assurance that we give to the patients these days?
Okay. See, if you compare the treatment of cancer, what was 30 years back, now it's drastically changed. One is again the three pillars of cancer treatment are one is surgery, chemotherapy, and radiation. Again,
Right.
surgery, there are a lot of changes in surgery. Earlier it was an open surgery, now it has come to a minimal invasive surgery, which can be either a laparoscopic surgery or a robotic surgery. Earlier days, where the patient used to stay in the hospital for after surgery, used to stay for 10 days. Nowadays, the patient stay only for 1 or 2 days after a major surgery. That's regarding
Right.
surgery. Next thing is
Right.
regarding chemotherapy. Now there are we have got targeted therapies and immunotherapies where the side effects are very less. Again, we have got oral chemotherapy where the patient need not get admitted; they can take the chemotherapy at home. And so this is a reason advances in chemotherapy. Again, coming to radiation, we have got a different. Earlier it was cobalt radiation. Then we have got linear accelerator. Now we have got cyber knife, gamma knife, and then we have got proton therapy where these treatment proton cyberknife all these treatments the side effects to the surrounding organ is very very less, so that directly attacks only the cancer cells. The surrounding normal tissue is not affected, so the side effects are less. So there have been rapid advances in the treatment of cancer over the past 20-30 years, which reduces the two things. One is the minimizes the treatment duration. Another is it minimizes side effects. There's a lot of
Okay.
treatment and we do not worry about it.
Wonderful. So as you were talking, I was also scrolling down to through the questions. There are more than 300 questions already there. I'll try and bundle up the questions and continue asking you the questions from our audience. As I was going down, I spotted one question which I'm not able to recollect the name. They were asking कि surgery के बाद there are quite a few cases they are fearing surgery in cancer because they've heard cases that people have expired after cancer surgery. So, is this a misconception, and what kind of assurance could you give?
So it's a definitely a big misconception. It takes a long time to come out of this. The thing is, what has happened is earlier days, whenever the patient had a big swelling, they used to go directly do a surgery. So there was no this protocols were not fixed. There was no test to which were done to see whether the cancer has spread anywhere else already. So nowadays we have got the PET scan, which shows that whether the cancer has spread already anywhere else or not. With most of the cancers, we do this PET scan. That is basically even before doing the surgery, we know the stage where the cancer is already. Then what happens? Then we go ahead and do the treatment. Let it be surgery, chemo, whatever. See, if you don't do this test, if you don't do the proper staging workup, then what happens is already the cancer would have spread. What will happen? Then patient would have got operated. Then the patient will think after surgery we have only got the cancer. This is not the case. The cancer would have already spread because we have not done the test. It will be like already. It will be like the cancer has recurred only after the surgery. That is not the case. It's a big misconception. I've been telling all the patients, if I see 20 patients a day, at least 10 patients ask me the same question. So I've been
Right.
more than enough.
We understand. Yes. Thank you for giving clarification there. Yeah. We understand that while this is a genuine kind of concern and fear, but this needs to be addressed and actually myths need to be busted. Thank you so much for giving that information. Yeah. Doctor, here's again, as we are talking about relapse, there are quite a few questions about reoccurring cancers and relapse of cancer. Charulata is asking, after surgery of breast cancer, no, yes, it's not Charulata's question. I missed the name. I'm sorry, but is breast cancer? Can a breast cancer reoccur? Is a relapse of cancer possible? I'm sorry. While looking for the patient's name, I couldn't get it.
No. So this is so another thing is any cancer can recur. So the thing is we always need a proper counseling to the patient, and the patient should also come with a very open mind to take up all the information what the doctor is telling. We always do the counseling session in 2 or 3 sittings, explain in detail about the patient's treatment, explain in detail about the outcomes and the cure percentage and the recurrent percentage. Everything we explain as an oncologist, we explain in detail very much. I strongly feel that we need to give all this information because the patient, only then the patient will come for regular checkups. See, any cancer can recur. As an oncologist, any oncologist would have discussed with the patient about the percentage of recurrences and percentage of cure. As a doctor, as an oncologist, for us to say, okay, the patient is completely cured, it will take minimum 5 years. So once the patient has undergone the treatment, after that, the patient needs to be a regular checkup for the next 5 years. Next 5 years, there are on regular checkups, the disease does not occur. Only then we'll say patient is completely cured. So this about it. And again, we need not worry about it. Based on every patient, every stage, grade, everything, you need to ask the oncologist, what is my percentage of recurrence? What is my percentage of cure? That any oncologist will tell you honestly.
Done. So here's a question about prostate cancer. Does Rakesh Ambasana is asking, does fourth stage prostate cancer get cured totally? Can clinical trials be done on fourth stage prostate cancer in India?
See, any stage 4 cancer, we will not say the patient will get cured. Any stage 4 cancer, let it be prostate or any other cancer, our idea of treatment is to prolong the survival. Okay, so that prolonging the survival, say it can happen for, you can say there are good treatments, good advances depending upon the patient factors, multiple factors, the biopsy report, depending upon the stage, everything, depending upon the location where it has occurred, everything. The outcomes can vary from somewhere between 2 years to 10 years also. The advanced prostate cancers can stay, can be alive. So we will not use the term, technically we cannot say, we will use the term of cure. Another thing is clinical trial. Say uh, every advanced cancer will have a evidence-based treatment, or any treatment is evidence-based. Again, we always give the first line of treatment, second line of treatment, third line of treatment. If everything fails, these first line, second line, third line is already proven. If all these fail and still the patient has got a recurrent disease, only still the patient's disease is progressing, only then we go for a clinical trial. Clinical trial, you need to enroll. See, that particular, whether the patient is a candidate for the clinical trial is a big question mark. And whether they are conducting any clinical trials, if that clinical trials, the patient is a candidate, then we can always enroll. It happens in India also. Then we can go ahead with the treatment. But the
Done.
patient should be a candidate. There are multiple factors.
Okay, done. So, asking a very general question, I think somebody is worried about it. Akshay Jyoti Conver, will antacids cause cancer if we take it for too long regularly?
I just want to know where she is from.
Akshay Jyoti Conver, I'm not sure, but it
Okay,
doesn't
I
look
have.
like a South Indian name.
Yeah. So the thing is, uh, most of the times, the majority of the people, they keep taking antacids. So if they don't take antacids, they are not happy about it. They're totally not happy. They keep saying we have got a gas problem, we have got issues and things. They just keep popping it. You need to know that antacids stops the acid secretion. That's what antacids do. Again, most of this gas problem has got nothing to do with acid. Most of the gas problem has got something to do with the diet which we eat. High oily diet, then high oily diet, late dinners, late lunch, and these are
Heavy
the things
meals.
which cause heavy meals. These are things which causes. Again, acid is secreted in the body for a reason. If you take an antacid to suppress the acid, obviously there are going to be side effects. There are proven studies and research and trials which have clearly shown keep taking antacid continuously causes stomach cancer. You should not take antacids. So antacids should not be taken on a regular basis. So whenever you got an ulcer problem, you meet a doctor. Doctor will give medicines for a week or 10 days or maximum 2 weeks. I have seen people who have taken antacids for 3 years, 4 years in a row. That is absolutely a no-no.
Okay, so please keep that, Akshay Jyoti Kanwar. Please keep that in mind, and it's also a great input for all the other viewers who are watching this show. Thank you, Doctor. So, next question is from Ms. Taniru Shravanti. My mother had cardiac condition with two stents already, and right breast is surgically removed for cancer. Currently using Letros, and how long does this treatment continue?
See, on an average, say again, it depends upon the stage and things like that. It somewhere varies between 5 to 10 years. 5 to 10 years, you need to take letrozole.
Okay,
That's the
done. Maithili, yeah. Thank you, doctor. Next question is from Maithili Rajendran. Aggressive angiomyxoma. I am not sure which kind of cancer that is, but is it curable? Will it recur again?
So, as we already discussed, any cancer can recur, and this can also recur. The only thing is, it does not spread usually to other areas. It usually affects that area. Wherever it has been operated in the same area, chance of it coming back is very high. So, you need to be on very close follow up by doing the regular investigations based on the area where it has happened. So,
Done.
it can recur.
So here's a question about an area which is not yet found out. Arun Kumar's question is, good morning, doctor. Is there an effective treatment for unknown primary metastatic carcinoma?
So there is that again also the metastasis of unknown origin. It's called MUO or metastasis of unknown origin. It can occur anywhere in the body. The patient can have just an axillary lymph node, or the patient can have a neck node, or the patient can have an inguinal node, or the patient can have just a liver metastasis. There's no evidence of any primary anywhere. Everything comes under the same group. Again, there is effective treatment for that. Again, the outcomes depend upon in which area it is occurring and things like that. And patients depend. There are this extreme patients with unknown primary have got completely cured. Also, again, some unknown primary succumb to the disease. So there are no trials and research, and we cannot put everything as one case. We need to take it step by step, and depending upon the site specific, there are no trials, and no trials can be done in the future also. So, but there are effective treatment, and some patients do get completely cured also.
Wonderful. That's very positive. So talking about cure in multiple stages, Karthik 80 is asking this question. Is ovarian cancer third stage curable?
So, ovarian cancer third stage is curable. Again, internationally, we have got a lot of recent advances in ovarian cancer management, say including a good chemos and surgery. There have been a lot of advances like HIPEC surgery and PIPEC surgery. All these extensive cytoreductive surgeries. There are good treatment modalities in surgery and chemotherapy which have occurred in the recent times in ovarian cancer. Again, stage 3 ovarian cancers with a good treatment, with extensive thing, internationally the percentage of cure is around 40%.
Okay, great. Next question is there a difference between regular cancers and prostate cancer? Is prostate cancer curable?
Yeah, say, prostate cancer is like yet another any cancer. There's not much of a difference. Only thing is prostate cancer, the outcomes are very good compared to some other cancers. Compared to pancreatic cancer or liver cancer, the prostate cancer, the outcomes are very, very good. So I think it's a kind of reasonably a good cancer where the outcomes are good. And even the follow-up checking and things like, we don't need to do extensive investigation. We can just do a simple blood test called serum PSA. We can do it once in 3 months or 4 months and keep a check on what's the progress and things like that. So prostate cancer is a good cancer. Cure percentage are high.
Wonderful. So, Amar Pushti's question is, how can we prevent cancer? And in continuation with that, let me also ask this question, which cooking oil is best to delay in getting cancer? VV Harish asked this question. So, does
So
lifestyle, diet, food choices, do these make any impact on our getting cancer or delaying cancer?
definitely, definitely it makes a lot of impact. Say we are, all of us are even scared. All of us are even, we are not even raising the question that there's a lot of pollution in our water. There's a lot of pollution in the vegetables. A lot of pollution, chemicals in the rice what we eat. Everywhere there's adulteration. It is a big issue which it has not been raised by anyone. It has not been made an issue at all. Say again, this needs to be, this was not the case earlier, like say 30 years, 40 years ago. This was not the case. So much of chemicals were never used. Again, our lifestyle is, we have all become sedentary lifestyle. We are just sitting with the lack of exercise, lack of work and things like that. Again, a lot of stress is involved in the work, day-to-day activities and things like that. And again, air pollution, that's another major thing. We just talk about it, we just leave it off. Everything put together, little by little by little, these are all causes cancer. I'm not saying one causes cancer, everything put together causes cancer. My question is, my answer to this is very simple. I think we should look at our grandparents, how they lived their life, how they eat, what time they ate, what kind of work they did. We should just try to emulate that, which will reduce the incidence of cancer.
Yes. So there's a very nice meme that I'd see. I can't say a meme, but a very interesting quote that I had seen. If there is a barcode, I'm not eating the food. So if it's a processed packaged food, then I'm not eating it. And that should be the mantra for all of us. Yeah. Thank you, doctor. And next question that I would want to take up is Rakesh Ambasana. Somatic BRCA is positive. Germline BRCA negative. 11 chemos have not decreased PSA level as well as comparable CT scan on July 21st and Feb 22. Reports say it to be static.
See, this entire situation, you need to consult the doctor. You need to send all the reports and have a detailed discussion. Once the doctor goes through, has a detailed discussion, only then we can answer the thing. With these
Right.
information, generally, I'll be sending out the wrong information.
Exactly. And this, cancer is not something that we can treat here right away. Dr. Venkat
Right.
can be consulted on Apollo 247. We'll definitely be leaving a link. Do go ahead with your consultations there. Thank you. And there are certain questions, Priya Mohan, Priyanka, then a lot of other people, Maunika. Your questions will not be taken up for today's session, definitely on a later session, or there are certain medical oncologists who can take this question, but not to Dr. Venkat. So please don't mind, I'm going to avoid your questions. Well, next question is, I'm sorry, doctor, just a second. Akshay Jyoti Kanwar ka antacid ka question hai na, she has repeated some 100 times, so I'm not able to locate next question immediately. Um, Done. Jayaraman S. I'm 70 years of age with prostate cancer. Had surgery now under hormone injections. What's the difference between? Yes, that's it. So, how long will this treatment continue? The hormone injection treatment continues.
I think it'll be lifelong. It'll be lifelong.
Okay, done.
It'll be
Thank you
as
so
simple as
much.
that. So
All
how
right.
we take medicine for BP and sugar lifelong, this also will be lifelong.
Okay, there's a question regarding Whipple procedure. I'm not sure what that is and which cancer does it mean. Amrita is asking, please go ahead if it's a relevant question here. My mother, 65 years old, had a surgery named Whipple procedure. After that, the report has come that she's in 3B. They've recommended chemo. Is it curable or do I have to go only for palliative care?
So again, Whipple's procedure is a surgery which we do for a cancer of the head of the pancreas, cancer of the bile duct, or cancer of the duodenum, or cancer of the lower common bile duct. This everything put together is what the Whipple's procedure we do. again based on the subtype, so whichever part, pancreas or bile duct or anything, the outcomes are different. Again, stage 3b can occur in any of these. So again, if it's a stage 3b, she's 65, she's undergone a Whipple's, and if the medical oncologist advised chemo, we need to take the chemo. Again, our entire idea of treatment is only curative. How much cure we achieve depends upon the subsite from where the cancer has arisen. And then you need to be, after this chemo, you need to be on regular checkup. Next 5 years, you're on checkup, disease does not come back. Only then we can say patient is cured. But I will definitely
Okay.
recommend you to proceed with the chemo. The general condition is good. No doubt about it.
Done. Done. So Padmanabhan Madabushi Srinivasa, he's asking after surgery and a full set of chemo and antibody sessions, is there a still chance of cancer development in any other part of the body? Female, 59-year-old.
What cancer, sir? Is it a breast cancer? She has not mentioned.
Unfortunately, they've not
No,
mentioned this.
it's
Yeah.
okay. I just take it as a thing. So definitely, so again, multiple times we have discussed. I don't want to be negative, but I just want to emphasize on this point that you need to be, say, how important treatment is. Follow up is very, very important. Any patient
Wonderful.
should be on follow up for the next 5 years. Next 5 years, after all these treatments, if they're on follow up for next 5 years and the disease does not come back again, only then we will say patient is completely cured. That's the thing.
Done, done. So next question is from Charulata. She asks, after a surgery of breast cancer, is chemotherapy compulsory?
See, that is a very general, very broad question. Again, I'll put it this way: most of the patients after breast cancer will require chemotherapy. However, there are subset of patients which, based on multiple the biopsy report, based on the immunohistochemistry report, and other things, so there's a subset of patients who will not require chemotherapy. That depends upon the biopsy report.
Okay,
So most
okay.
of the people,
Done. So this is about chemo, and Amar Prasthi is asking, chemo and radiation as a combination, is it compulsory, and can one have a choice of having only one?
again, he has not mentioned about what cancer
It's
and things
just
like that.
general, yeah, general information
Again,
about different, yeah.
no, no. Again, see, as I said, there are only three treatment modalities in cancer. Some cancers will require all three modalities. Some cancers will require only two modalities, and so that whenever it's required, you need to take it as and when your medical oncologist or surgical oncologist or radiation oncologist, whatever they opine based on the type of cancer, you need to take it.
Okay, so that is one. And next question is, what is targeted therapy, and how much success rate do you think is there for targeted therapy? Vinod Senwal is asking this question.
So again, it's a kind of a chemotherapy. It comes under the chemotherapy category only.
Okay, okay.
Again, as such, it is not, say, there is no treatment only giving targeted therapy or something like that. It's a part of the entire treatment process. Targeted therapy alone, you cannot say I'll use targeted therapy, the treatment will be a success and things like that. It also depends upon for what cancer, in which stage, what we are using. But it's a novel modality of treatment where the outcomes are very good with lesser side effects.
Done. Here's a very general question, but a very important and important point for you and all of us to reiterate this. Narsimharaju Ditchpalli, who's a regular viewer on the show. Good morning, doctor. Packed juices, and junk foods. Are we sure that this leads to cancer?
So definitely, sir. Again, whatever is packed, they have got some preservatives. Say, I'm not saying all packed foods lead to cancer, but again, I'm just trying to tell you is let us keep everything fresh. Let us keep everything pollution free and adulteration, less of chemicals, everything, and let us go back to the basic diet what our grandparents have been following. That's the best thing. That'll be my best advice to you.
Thank you. But out of my curiosity and out of my own interest, doctor, this comes. Rice is something that all of us, especially in South India, that we are dependent on. And the kind of pesticide and the kind of fertilizers that they use to promote, even wheat that matter, even in North India. Talking about Punjab and Haryana, the kind of cancers and the cancer express that goes, which runs through these states. What do you think that we can do? Where do we source our good food?
See, Again, I don't know. Say the so far or as the organic food, which people say I don't know how organic it is, or it's just a marketing issue. But the thing is, that's why I said the entire system. We don't talk much about the pesticides, what is used for making our food.
Cultivation.
It's a very sensitive issue. Again, it's very touchy topic for everyone. I think
Right.
that needs to be addressed. That is all just being brushed under the carpet. We talk a lot
It is
about
time that
smoke.
we talk about it, doctor. Like we are seeing this increase in number of cancer across the country, length and breadth of the country, and we are not talking about the root cause, which is high time that we need to talk about it.
Again, you see well-developed countries, they are very strict about using the pesticides and everything. Here in India, it's a little tricky thing. So I feel that needs to be addressed. We have not been addressing it. Imagine, how can you say take, it's literally like taking chemicals. Again, sometimes you buy spinach is literally like stinking of chemicals and things like that. You know it is bad. So I think we just need, it needs to be addressed in a very broad way.
True.
And you and
And
me
these young
will.
girls, yes. Doctor, I know it's not a question right now from the audience, but for the benefit of the audience, the kind of vaccines that we have for HPV for younger girls, would you promote vaccines which can prevent cancers after they grow up?
Definitely. I think one of the cancers, and a 98 percentage of the cervical cancers are associated with human papilloma virus. So again, why not? This vaccine will not do any harm. Definitely, it will do a benefit. And 100%, I'm a strong believer of HPV vaccine. And this vaccine should be taken before the age of 21, and that's the right thing to do. And somewhere even before 18 and things like that. Somewhere between 11 to 21 is the right time to take this vaccine. 3 doses should be taken. You can consult a pediatrician or a gynecologist and take it, or one of the oncologists and take it. So I'm a
Wonderful.
strong of human papilloma virus, because this particular cancer can be prevented. It's a very preventable cancer. So we need to take all preventions to do it, because the entire burden, the system burden, everything comes down.
Correct. Because we are talking about cancers which cannot be prevented, while we're talking about cancers which we're getting from environmental causes. When there is a cancer which can be prevented with a small shot, we should go ahead and get this done. And wonderful, doctor. Thank you so much for that information. And next question is Jitendra Chauhan's question. What is the standard cancer treatment protocol for endometrioid androcarcinoma, when where to find it?
So there's nothing called to say again. There are treatment protocols. Any cancer, we need to do a staging investigation. Either we need to do an MRI scan for this particular scenario, or a PET scan. Either of this. Again, we need to do a biopsy based on the stage. Most of the endometrial cancers are predominant. Almost 80% of endometrial cancers are stage one. Again, the most of the times the predominant treatment will be a surgical management. And after surgical management, based on the biopsy report, then we will, seeing the report, then we will say whether any radiation is required or not. Sometimes the patient might require internal radiation called brachytherapy. Sometimes the patient will require internal and external radiation. Some patients with endometrial cancers will also require chemotherapy. So endometrial cancer, most of the times the stage one, it's a very potentially curable cancers. And this is where robotic surgery also plays a very important role in endometrial cancers. It helps us to give a good treatment and things like that. Endometrial cancers, the treatments are very standardized, and you should just approach your doctor and take it forward.
Done. As you're talking about endometrial cancer, initial 11 o'clock or something, I saw a question which I forgot to ask you. Taking tamoxifen, some kind of a drug, in cancer treatment, somebody's endometrial thickness is increasing, and can this be reversible, and will this cause harm in future? I'll figure out the name in a short while and let you know, doctor.
See, again, one of the side effects of tamoxifen is that can also cause endometrial cancer. So again, whenever we start the patient on this treatment, as a doctor, all of us know this issue can happen. That's why we tell the patients any abnormal bleeding, any intermenstrual bleeding, get in touch with the doctor. Again, whenever the patient comes for follow-up, either once in 6 months or once in a year, we do a transvaginal scan to check the endometrial thickness. If the endometrial thickness is increasing, not all endometrial thickness increasing is endometrial cancer. If the endometrial thickness is progressively increasing, then we even advise a biopsy. In case the biopsy turns out to be positive, then we do a surgery. I think again the tamoxifen is given as a part of treatment of the breast cancer. One small subset of patient can develop endometrial cancer, but that also can be picked up early if the patients are on regular checkup, which we expect the patient to be on regular checkup.
Done. So, talking about early screening, lot of questions about when to get the screening done, what are the tests to be done, who needs to, and what are the centers that one can go for. Who is the right person to guide them, doctor? And I don't want to take individual names because there are too many questions in this regard.
I think regarding screening, it's, as I mentioned, it depends upon from organ to organ. I'll just stick to one organ. I'll just stick only to breast. So because screening plays a very important role in breast cancer. So lot of death can be prevented by proper screening, and lot of treatment related the treatment can be simplified by doing a proper screening in breast cancer. And most of the times when you do a screening test, again we can avoid the breast removal itself. So I'll stick on to breast cancer screening. Breast cancer screening, any lady above the age of, there are no, okay, I'll just, before starting it, I'll tell you, there are no guidelines as in India for who to get a breast cancer screening. But I always recommend any patient with a breast, any patient about any person above the age of 40 should undergo an annual mammogram. Again, to this, what happens most of the times, the patients will be like, if I take a mammogram annually, isn't it dangerous? The answer is, the answer is
Exposure
no,
to
it is not.
radiation.
The answer is no, it does not cause any harm, it's only of benefit to you. Again,
I
whenever
do
the
it
patient has got,
regularly, doctor. I
that's
do it
very good.
regularly, and I also want the audience to understand that there's nothing wrong. And if you are asked to get it regularly, then please go ahead, and it's a boon that you're doing for
Definitely
yourself,
for yourself and your family. Another
family.
thing is, another thing is, any patient with a strong family history, we always advise the screening to start from the age of 35. We advise the patients to do a mammogram, MRI mammogram. Another simple tool for screening is, I advise all the patients, let it from the age of 30, to undergo a monthly breast self examination. That should be done in front of the mirror when you're having the bath and after applying the soap, and then it should be done after 10 days after your period. Somewhere in the mid cycle, you need to do it. You need to do
Yeah.
it with the tip of the finger, and you need to palpate, go from a clockwise direction, checking all parts of the breast. And again, from the right breast, you need to go in an anti clockwise direction. Breast self examination is a very, very, very important tool which you have got in your own hands. Only thing is, you need to apply and make use of the tool. This is very, very important,
Right.
and take home for that.
Wonderful, doctor. And I do it. I urge everybody, and I'm also an advocate for talking people of taking charge of their bodies. Do not shy away from your body. Shirley
Very
Holder
true.
is asking next question. Female, 31-year-old. I have breast pain for past 3 days, and then went for an examination. Doctor gave me some tablets, but still uncomfortable. I have sagging breast recently that gives pain. And also somebody else was asking about changes in breast and when to understand. So these are, earlier people used to shy away, but now people are talking. I'm glad that she's come up and asked. So is
So
this
again,
who and what time of a period that a woman needs to understand that breast tenderness is normal and pain is normal?
and Shirley, I don't think she has mentioned her age. I don't think she has mentioned the
31 year
age.
olds.
Sorry, I didn't hear. Okay, again, do not worry. I'm just telling you simple. Most of the time, breast cancer does not cause any pain at all. It does not cause any pain at all. And so again, here it's predominantly due to hormonal changes. It's called mastalgia. Mastalgia is divided into two types: either cyclical mastalgia, which are usually associated before or after your periods. That's called cyclical mastalgia. And non-cyclical mastalgia, it can occur anytime. These are all predominantly due to hormone-related issues. Most of the time, these this mastalgia just automatically settles down. You don't need to undergo any active intervention. Again, most of the time, the fear is whether it's cancer. I'm just giving you a simple tip for your fear. Most of the time, breast cancer do not occur with a pain. It just occurs as a painless lump. So you need not worry about it. Again, sagging breast is a very natural process. As we all grow old, the breast starts sagging. I don't think you need to worry about it and things like that. So the only thing which you need to worry is, you need to look out for any painless lump in the breast that you need to look out for. You need to look out for any skin changes in the breast, something like something it's called pudgy orange, where the breast develops some redness and skin thickening. Another thing is you need to look for nipple inversion, nipple retraction, sometimes abnormal discharge in the nipple. These are the things which you need to look out for. This breast pain is most of the time either cyclical or acyclical mastalgia. You need not worry about it.
Great information. Thank you so much, Doctor. Doctor, this is a question which is repeatedly, somebody is trying to seek our help here, which I understand that's the reason why they type too many times the same question. Pavan Chandra ji, your question, I don't think Doctor will be the right, he's given us certain conditions of asking questions. So we don't think he'll be able to answer this, but from the doctor, because he's concerned about a three-year-old son, BMT T cell ALL the child is going through. So I understand that you don't take up certain blood and bone marrow issues, but doctor, who does he need to consult?
So sorry, I'm a surgical oncologist. I don't deal with blood cancers. I think you need to meet a pediatric medical oncologist or a pediatric hematologist. These two will be the right people to guide you and do the needful for the child.
Great.
Pediatric hematologist or pediatric medical oncologist.
Great, doctor. Thank you so much for answering that. Along with Mr. Pavan Chandra, there are a lot of people who have been asking about the cancers related to blood. We'll unfortunately not be able to take that issue right now. Definitely on a later episode, we promise to come back with an expert who can answer these questions. Venkatji, to continue, here's a question about how long will rucaparib work for somatic BRCA, positive in fourth stage prostate, once the medicine is started? I didn't understand the relevance of the question, so I just stated.
This is a question again. It cannot be answered in a one word or something. We need to look at the holistically all the reports, and then only we need to take a call.
Done. Also, getting too many. Manoranjan Kumar ji, आपका question यहाँ पर हम लोग answer नहीं कर पाएंगे. The same reason that doctor said that he is a surgical oncologist. So a lot of questions. What is electronic Wi-Fi at home or electronic gadgets which have radiation? Can these also be a risk of developing cancers over time? Understanding that mobile phones and the radiation, the cell towers and radiation, 5G and radiation, बहुत सारे WhatsApp forwards that we hear, doctor. What is your take on this? This question is from Mr. Mohammed Shoaib.
See, so far there has not been any evidence to prove that these electronic items causes any cancer. There's absolutely been no evidence. Again, regarding mobile phone, Wi-Fi, and things like that, also so far there has not been any really proven thing. But as a caution for the this thing for the mobile towers and 5G and things like, it's a very caution. See, when smoking started, when all of them started smoking in US, there was no evidence that smoking causes lung cancer. It took around 30 years to say that, yes, the cause of lung cancer is only smoking. We don't know what is going to be the answer after a 10 or 15 years period. So right now, there are no evidence to prove. The same thing was the same when we started smoking at the early stages and things like that. The impact of smoking started only around 30 years later. Again, the smoking lobby was very strong. They didn't let the information leak for a very long time. And slowly it only leaked out. We just need to wait and see how things are unfolding in the next 10, 15 years.
Yes. Unfortunately, I don't know if it's right to add it here. The tobacco lobby and the smoking lobby that you were mentioning earlier had their own personal interests. But right now, if we talk about the technology and the radiation, we have our work and other relations as a customer relation. So we might not let it come out. There are certain studies. So we just hope and pray. Yeah. Quick question. Does having... Yes, doctor. Yeah. Akhil Sheikh says, does strong immunity play in a role of preventing cancer?
See, there is no proven evidence to show that strong immunity has got a positive effect on the cancer and things like that. I think, again, immunity cannot be proven by any test or anything like that. And again, I think having a good food, a good balanced lifestyle with active exercise, I think that gives you a strong immunity. That in turn should definitely prevent your incidence of developing a cancer.
Done. So here's another question from Sukriti Suri. After completion of treatment for stage 1 ER and PR positive breast cancer, is it necessary to anti-hormone medications? Can these medications be avoided? How long, if in case that we have to take, how long does one have to take?
So if the HER2 new is positive, then as a doctor, we definitely recommend antibody treatment. So that needs to be taken. Again, it's like it all depends upon multiple factors. It's not only one factor. It depends upon multiple factors, size of the lesion, the other factors, for 7 or 8 factors taken into consideration. Then we definitely recommend it. And usually it will be a dose of around 15 doses, which we need to recommend and things like that. And most of the times what happens, the injection cost is little expensive. That way most of the time this query comes. Again, we tell them there is definitely a proven evidence that the percentage of recurrence reduces by around 10 to 15%. We advise the patient to definitely strongly take it and things like that. It's always better to take it rather than one with difficulty, rather than to once it recurs, again your percentage of cure goes down. Again, automatically your treatment is going to go up and things like the cost is going to go up and things like that. Again, depending upon multiple factors, your medical oncologist advises, he is advising based on the evidence-based medicine, which is a standard practice done all over the world. So I'll definitely recommend you to take it.
Done. And last question for today's session, Dr. Deeptanshu Chowdhury is asking, please explain the lesion size and Suvmax in PET-CT reports, how their values in continuous PET-CT after every 3 cycle will help us to conclude the progress of treatment. Male, 48-year-old.
So I don't say, again, you have not mentioned about the what tumor and things like that. Again, with the due respects, I'm telling you, I don't think you should try to interpret reading the report. That interpreting will be done by the doctor who is treating it. Definitely the doctor is not going to hide anything from you. Whether it's a good news or a bad news, he's going to tell you. If the doctor says there's a reason why the doctor is asking for a PET scan once in 6 months or a year or so, and just take the PET scan, give the information to the doctor will read it, go through the information, and he will give you the answer to it. I don't think you should try to interpret it this way. Again, numbers do not really matter most of the times.
Great, doctor. Thank you so much for having so much of patience in answering each question so patiently. We promise our audience that we'll come back with yet another session to address most of the questions which we couldn't answer here. But Dr. Venkat, a number of questions which were coming were how to identify and take a test to prevent cancer. I would request you to give me top tips to identify and what kind of tests to take.
Again, there's no single test which we can do and say, you do this test, we will know whether cancer is coming or not coming and things like that. There's nothing like that there. Again, another thing is what we need to understand is there are multiple cancers. Each and every cancer, the screening pattern is different. So I don't think we need to worry about it. I think we should just consult the doctor who's concerned based on your family history and things like that. He will advise you what test to do and things like that. So need not worry about it.
Right. So, regarding the top tips, what are the tests that one can take and all? We've been discussing. So, it's always in your hand. Be proactive and lifestyle changes and diet. Would you want to reiterate on the top tips, doctor?
Definitely. Say again, I will say have an active lifestyle. Second thing is avoid junk food. Third is avoid smoking. Alcohol maybe very mild, moderate, mild thing is consumption is okay. And thing is you need to have a little stress-free life. All this will only prevent the development of cancers and things like that. Because most of the time now the cancers are changing into, it's more of a lifestyle disease. Most of the times few things are under our control. What all we have mentioned is under our control. The pollution in the air, the pollution in the food we eat is not fully under our control. So there's nothing much to worry about right now in cancer. The early you identify, the cure percentage is more. There are good treatments for cancer. Let it be any modality, surgery, chemotherapy, or radiation. There are good treatments. The cure percentage are less. And all we need to do is get a proper advice from the doctor, meet the oncologist, just follow the oncologist what they say and just follow it. The percentage of cure and your anxiety will be relieved.
Great. Thank you so much, Dr. Venkat. It has been a pleasure to have you on the show this Sunday. Thank you once again for enlightening us. Thank
Thank
you.
you so much. I hope like it was useful for people who required it. Another thing to just finish it, I'll just say, please do not Google information about cancer and see. I have seen it leads to a lot of anxiety. It doesn't lead to, it doesn't give a pleasant feeling. Whatever doubts or questions you have got, please note it down when you meet your oncologist and ask them. Any oncologist is going to give you the straightforward answer. He's not going to beat around the bush. So that's my only advice for you.
Thank you. With that valuable piece of information, we take leave
Thank you.
from you, Doctor. Thank you.
Thank you.
Well, that is Dr. Venkat P for you answering all the questions on cancer and prevention and causes, treatment options. Now it's your turn to answer my questions. I'm going to ask you 3 questions. Please type your answer in the chat box. Winner's name will be announced towards the end of the show, towards the end. And winners will be selected the sole discretion of Apollo 247 team. Winners to mail their contact details at marketing@apollo247.com. We shall share the gift vouchers to you. All right, time for the health quiz. 3 questions on the screen right now for you. When is the World Cancer Day observed? अगर आपने शो पहले से देखा है तो we have started the initial discussion with this. When is the World Cancer Day observed? Question number 2. What is the cancer of the blood cells called? A lot of questions about this in the show, but we couldn't answer them. Definitely in the next show. What is the cancer of the blood cells called? Question number 3. Which option on Apollo 247 app enables you to consult with an Apollo doctor in just 15 minutes? Question number 3, I repeat, which option on Apollo 247 app enables you to consult a doctor from Apollo hospitals in just 15 minutes? So, but answer pata hai to type kar dijiye, and I'm waiting for the winners. Go ahead and type your answers in the chat box. Before we get the winners, let's talk about the payday sale. Get flat 26% off on first 3 online medicine orders. You have to use the coupon code FIRST3, FIRST, numeral 3. And also, additional benefit here, if you pay via Amazon Pay, you can earn up to 500 rupees off. It's a wonderful deal. It's a payday sale, so not for a very long time. Get flat 26% off on first 3 online medicine orders. Use the code FIRST3. So that is about the payday sale. And I'm also going to give you one clue here. This slide is also giving you just one tap. You can have an Apollo doctor's consultation. You can talk to a general physician online in just 15 minutes at rupees 249 rupees only. Yes, you've heard it right. Under 15 minutes at rupees 249 rupees. You can talk to a general physician. All this can happen only on Apollo 247 app. So go ahead, download the app and have the app in hand to avail benefits. Payday sale ho ya just one tap ho, or any other coupon code that I'm going to share on the show. You are going to use them on Apollo 247 app. Here's a coupon code that you can use, that is HH247. You can get 199 rupees off on online consultation with Apollo doctors, and also 20% off on medicine orders. Use that on Apollo 247. Download the app. And now for the winners of today's session. 1 is Prithvi, 2 is Lavanya Chelipilla, and 3 Rekha Chintala. Congratulations, all of you. Please write back to us to claim your gift vouchers. Thank you, all of you. And this is today's session. Next week, we are going to talk about an interesting session. It's going to be about heart diseases, know the risk factors and prevention from an Apollo expert. So Sunday, 13th of February, that is 11 a.m. If you don't want to forget this, if you want a reminder if you need a reminder, there's a bell icon. Please go ahead, subscribe that, and then you do not miss a session. Thank you so much, all of you, for joining us today. It was a very interesting session, Dr. Venkat. You were really very enlightening. Thank you so much, audience, for asking your questions. So keep asking your questions, because your question is answer for many people. This is it for today. We'll see you in the next session. Namaskar.